Bald. I'd like to move on to the, whether we're managing to have the public health measures and control measures that are effective. I'm really concerned that we've gone from almost elimination through to restrictions affecting more than 1 million people in a large chunk of our country. And in particular, I want to focus on the contributory factors of the quarantine measures and the spot checks, but also the test and protect, and whether you have confidence in both of those measures, because we know that there are some reports about compliance and about missing people as well in terms of the quarantine checks. So I'd just be interested in your view on that.
Okay, so this is the crux of the issue now, is how did we get to where we are now, which is the elimination strategy, zero COVID as is often called, or maximum suppression, which is probably a better term, is definitely what the Scottish Government has been trying to pursue. And if you look at the data for June, in particular July, we were very successful actually as a nation in getting those numbers down to a lesser extent part of May as well. So I think we did very well, reasonably well during the summer. But the problem is the numbers are now up again, and that was not unexpected. Most of us expected that. And the main drivers for that are, briefly, as we know, the virus, because it wasn't totally eliminated like the Faroe Islands or New Zealand, it was always potentially going to be spreading again when people started moving around more, and that's exactly what has happened. But the other thing, of course, is that we can't cut ourselves off. So I think travel has been a problem. It's absolutely clear that people coming back into the country have brought the virus with them. We've got specific examples of that, and quarantine is not being followed. So your two issues, test and protect and quarantine. If you ask me, do I think test and protect is working? From the data that I've seen and discussions with my colleagues involved in the system, I think it is working very well, as much as it can, but there are problems sometimes out with their control. Now, the first part of test and protect is test. That's where the problem is at the moment. I don't think the problem's in the contact tracing. I think the teams are very skilled and they're doing that to the best of their ability. And of course, we'll have the app, which I think is going to add on top of that. But if we can get rapid testing, we really are in trouble. And I think the situation we've seen with people not being able to get access to tests is worrying. And England is in the middle of that right now. Clearly, there's a problem with lab capacity. And so this commitment of the Scottish Government to get up to 60,000 tests a day, what did we do yesterday? 19,000, I think. We're nowhere near that. So testing is absolutely crucial. We need mass testing, more testing. And I think, this committee and others need to keep communicating that message that, and I know it's not Scotland, we're reliant on a UK system as well. We really, really, really must improve our capacity and our ability, and also to move with technology. So to be doing group testing where you put samples together, they're tested together, and if there's no virus in 20 samples, you've heard about that approach. The saliva testing, which is now going to be available and is much less invasive and more tolerable for people. These are things that we need to be using. And then finally on quarantine, I think I've said several times publicly that if you look at there's a good paper published last week that showed that actually only 25% of people, this is a UK paper, who were advised to self-isolate, reported in a study that they were doing that comprehensively. And if it was me, I could understand why it might be tough to do that, particularly if you don't have enough resources to be able to do it. And incoming travellers are not following the guidance necessarily. We've seen examples of that. And the penalties and the enforcement of that, I think, are pretty limited, the follow-up, although I can't comment on that in detail. I think looking ahead, airport testing is going to be something that we will require. And I know that Scottish and UK governments have been very honest about the fact that there are key questions, first of all, related to the timing of the second test in particular. So do you do it on day 5 or day 8? And what proportion of cases does that mean that you miss? So there are genuine scientific questions about that. I accept it, but other countries are doing it. But I think the bigger issue why we don't have airport testing yet is an infrastructure one. If you have got a system which is not operating at scale in the community, then to add a layer of very complex new system on top of that, I think is a big, big challenge. But I will be relatively confident that we're going to have to embrace that in the future, because if you have mandatory airport testing, repeat testing, I think that will minimize the risk of people not following what essentially is voluntary quarantine. I think there are problems with that.